Hello, everybody. My name is Ryan Watt from Community Solutions and Built for Zero, and I'm going to walk you through the COVID-19 cost estimator tool, which is available on the Built for Zero website. This tool is intended to allow you to make estimates of the need and cost for two different kinds of interventions. One of the interventions is for quarantine and isolation beds. So these are beds for members of the population of people experiencing homelessness who are either positive or presumptively positive or under investigation for COVID-19. And so therefore need to be isolated from the rest of the population. That's one intervention. The second intervention is for providing permanent placement beds for 1 year for members of the population of people experiencing homelessness who might be particularly vulnerable to the severest effects of COVID-19. We allow you to estimate that population in two different ways, which are not mutually exclusive. One is by estimating the share of beds available for those who are 50 plus. Those are folks who would be more likely to be medically vulnerable. Another way is by estimating the number of beds available for those who are chronically homeless. And that population obviously may have a number of health characteristics that make them more vulnerable. A couple of notes before we start running through this. One, this tool was developed on the basis of a paper by Dennis Culhane and colleagues at the University of Pennsylvania. That paper is linked in the user guide, which in turn is linked here. And two, we recognize that this tool is far from complete and will likely make a number of assumptions that do not apply in every community. And so we recommend understanding this tool as a way to calculate the order of magnitude, both need and cost, and not as a way to estimate the precise amount that these beds will cost. Last note before we get started, the user guide, as I mentioned, is linked in the tool, so you can open that up if you'd like much more detail about what I'm talking about. And then secondly, although I'm using Alaska Balance of State to pull in PIT numbers, I want to acknowledge that I'm going to be making the numbers up as we go along, and they bear no relationship to Alaska's actual numbers. And if you're in Alaska Balance of State, hello. All right, so first I'm going to show you how to model costs for quarantine and isolation beds. The first data point you'll need to enter is the number of months you'd like to model costs for. You might project, for example, that you only will need quarantine and isolation beds for 3 months' time. In that case, you'd enter 3 here. You can enter any number. You'll see that it immediately updates up top to indicate that you're modeling for 3 months. The next thing you need to do is establish the universe over which you're going to model costs. So this is the total number of individuals who are experiencing homelessness in your community. We recognize that individuals only make up one portion of the number of people experiencing homelessness in the community. There's, of course, people in families as well. The reason the tool defaults to individuals is that in most communities nationwide, most families who are experiencing homelessness are sheltered in units that are able to be isolated from one another. So we pull in the PIT data on individuals as a cue for you, but we recognize that if you want to, for example, increase that number by a certain amount to account for families or any other population you'd like to model for, you can do so. So that's the universe. In the next box, you have to enter what turns out to be a fairly sensitive assumption, which is the share of people you predict will be infected at any one time at the height of the pandemic. So even if you believe that 85% of the population of people experiencing homelessness will be infected over the course of the pandemic, it might be the case that a lower percentage will be infected at any one time. Based on Dennis Culhane's research, we're estimating that 40% of the population will be infected at one time at the peak of the pandemic, and that therefore is the limiting factor for the number of quarantine and isolation beds you'll need. So we now have the length of time, we have the universe, and we have the share of the universe that we need to provide beds for. The last thing we need to make an estimate up here is the total cost per person per night. The UPenn research we cited from March 25th estimates the figure at $68.50 per person per night. If I enter that figure, you'll see that the costs immediately update by saying we need to provide 300 beds at a total cost of about 1.9 million, 2,000 per bed per month, and 625,000 per month. You may know that in your community, that figure is going to be higher, including staff, including food, including all sorts of other things. So you may estimate, for example, 120 per person per night, and the costs immediately update. You might also say that, we don't actually believe that 40% is the right number, adjust down to 20%. You might say that this figure can be revised, and you'll see all the numbers update accordingly. So that's how we estimate quarantine and isolation beds. Long-term placements, which as I mentioned are estimated over two populations, those 50 plus and the chronically homeless individuals, similar principle. First, we're going to try to estimate the number of individuals experiencing homelessness who are over the age of 50. Nationally, we think that number is about 40%. Your number may vary. You then provide the number of individuals who are experiencing chronic homelessness. Again, we provide your PIT number as a cube, but you can enter whatever number makes sense. And then we estimate the annual cost per year to place someone in permanent housing. Based on National Alliance to End Homelessness estimates, we think that number is about $12,800 per year, but you will know better. As soon as I enter those three figures, these estimates come to the fore. You'll notice that the estimates, again, are not mutually exclusive. Some of these people who are 50 plus will of course be chronically homeless as well. So we do not recommend adding these two figures as a total cost. It's just to provide you two different ways of estimating the total cost of permanent placement, two different populations that you might be interested in. If you have a different way of defining medically vulnerable populations, you can use the chronic homelessness data entry point to enter any number of individuals you would like and estimate permanent placement costs on that basis. So we've now seen how to estimate quarantine and isolation beds for a certain amount of months and permanent placement beds for 1 year. The last thing that this tool allows you to do is indicate the funding you've already received for these beds and try to estimate a gap between what's needed. So right now we have the estimated cost for the two interventions, and we have a gap, which is 100% of that cost because we haven't indicated any funds already allocated. There's two ways you can indicate funds. One is you can indicate beds you've already secured at a certain cost. So if, for example, the Holiday Inn has given you 40 beds and they are charging you, I don't know, $75,000 for that, or $76,000, then I can indicate that here, and the cost immediately updates, basically charging 100 beds, that's 140 minus 40, at the original cost you provided up here, and then the last 40 at the $76,000 cost you provided here. So if I, for example, delete this momentarily, you'll see that the cost drops significantly because it's assuming that those 40 beds are costed zero. You tell it that it's costed $76,000 and that number gets added back in. You can then say the Days Inn has an additional 45 beds and those cost $120,000. And you'll see that the cost is updated accordingly here and here. And also the $196,000 you've indicated here is indicated as money you've already secured. And so your gap has dropped accordingly. The same principle applies for permanent placement beds. You can also indicate funding that you've received, but that you have not yet allocated. So we have the $196,000 already in place. And then you can indicate that you're getting federal ESG money, maybe on a state pass-through. And you can say, we think we're gonna get $500,000. Suddenly your gap is down to $102,000 because it's summing the $500,000 and the $196,000 for a total existing funding of nearly $700,000, and that gives you a smaller gap. Again, the exact same holds true for permanent placement. Again, we know that this tool is not perfect. We know, for example, that it estimates that you will need to provide peak beds over the entire course of the months that you hope to model. If you'd like to model for just 1 month and take it a month at a time, you can do so and lower your cost accordingly. We know that these two populations are not mutually exclusive. Again, if you'd like to estimate a different population who are medically vulnerable, we recommend using this row 33 to change the population here. And we know, of course, that the costs that we provide as a cue for you will not apply in your community. And so we recommend that you use whatever data is most accurate for all of these data fields. We hope this tool is useful, and we thank you for all your work that you're doing for your communities. Thank you very much.